Hi there, welcome back to Little Growing Bonds, or welcome to Little Growing Bonds if it's your first time here. My name is Judith Nasazi. I'm a pediatric orthopedic surgeon. So today we're talking about something that often surprises parents when they hear it the first time, and that is clubfoot deformity or clubfoot. So it sounds worrying, but with proper treatment, babies born with clubfoot can walk, run, and live completely normal life. So be sure to stick around till the end because I'll be answering some of the questions I get asked a lot about by parents about clubfoot. But before we dive in, if you're new here and you care about your child's bone and muscle health, please hit the subscribe button so you don't miss any future videos just like this one. Now, what is clubfoot? Clubfoot or talipes equinovarus is a condition where the baby's foot is twisted inward and downwards, and it can affect either one foot or both feet. When you look at the foot, it may seem like it's pointing towards the opposite leg, and it can't be placed to like step on a flat surface. It sort of steps on the side border of the foot. The good news is it's one of the most treatable conditions that children are born with. So if you've noticed something unusual about your baby's feet or legs, drop a comment below. I'll be happy to explain what might be going on. What are the causes of clubfoot? Many parents wonder what caused this. The truth is, in most cases, we don't know exactly why. It's believed to happen while the baby is developing in the womb. The muscles, the tendons, and the bones in the leg and the foot form in an abnormal way. Some known factors include things like genetics, so it sometimes runs in families. I treat some families where the parents or maybe all of the children have had clubfoot. It can also be as a result of the position in the womb. So though it's less common, limited space during pregnancy can contribute to this. It can also be because of associated factors. So sometimes clubfoot occurs along with neuromuscular conditions like spina bifida and other syndromes like arthrogryposis. But in most babies, it's simply what we call idiopathic, meaning it happens without any clear cause. If you've heard about clubfoot in your family, give this video a thumbs up. It helps more parents find reliable information instead of the online myths surrounding these conditions. Let's talk about the symptoms and how to recognize clubfoot. Clubfoot is usually noticed right at birth or even before birth through an ultrasound. You may notice that one, the foot is turned inwards or downwards. Also, the calf on that leg often looks smaller. Third, the foot feels a bit stiff and doesn't normally move easily when it's tried to move. So despite how it looks, clubfoot is not painful for the baby, but it does need early treatment to ensure normal walking later for the child. And that leads us to the treatment of clubfoot. How do we treat clubfoot? The main goal of treatment is to straighten the foot and make it flexible and functional so your child can walk normally. The most effective method used worldwide is called the Ponseti method. It includes one, serial casting. So this is started as soon as they can start, typically in the first weeks of life. About 5 to 6 casts are used, which are changed every week. There's gradual stretching that happens to try and get the foot to the correct position. After the casting, a minor procedure called the TENOTOMY is done. This requires lengthening the tight Achilles tendon to try and get the foot down at the back. The third bit of treatment is called bracing. So after the casting phase, after the TENOTOMY, the child gets into special shoes that try to maintain the corrected position of the foot. Without bracing, the foot can turn back in. This is very crucial. When done correctly and followed through, the success rate for treatment of clubfoot is nearly 95%. So if your baby has just been diagnosed with clubfoot, don't lose hope. Comment clubfoot below and I'll share some more resources to help you start treatment confidently. Let's talk about a few tips and tricks for parents. So here are a few tips to help you along the way. One is start early. The sooner treatment starts, ideally in the first few weeks of life, the better the results. 2, follow the schedule. So don't miss cast appointments or breast checks. Consistency is key here. The third thing is please stay patient. It does take time and it's normal to feel overwhelmed in the beginning, but it does get better. The fourth is make the breast routine part of the daily routine, part of the daily life. So some babies fuss a little bit, especially in the start, but they quickly adjust. Ask questions as much as you can. Understanding each step helps you feel more in control of the care of your child. So connect with the parents if you're alone. Many families have walked this journey successfully, and so you will be fine as well. So if you started the Ponseti journey, let me know in the comments below. How is your baby doing so far? I would be very happy to know. So I know how frightening it can be to hear that that your new baby is born. I know how frightening it can be that to hear that your baby is born with a foot deformity. But remember, clubfoot is completely treatable. With early and consistent care, your child can walk, run, and play just like any other child. So your love, patience, and commitment to treatment makes all the difference. You are your child's biggest strength in this journey, and the outcome is almost always full recovery. Now let's answer a few questions that are commonly asked about clubfoot. For any parent trying to navigate the clubfoot diagnosis, the questions can feel endless. So let's tackle some of the biggest fears right now. One, is it my fault? The answer is a huge emphatic no. The exact cause of clubfoot is unknown, but it's thought to be a mix of genetic and environmental factors. It's absolutely not caused by anything you did or didn't do during the pregnancy. It just happens, and it's nobody's fault. So second, does the treatment hurt my baby? This is a major worry for parents, but parents are typically shocked at how well the babies handle the Ponseti treatment. The weekly stretches are gentle. Most infants are not bothered at all. They might get a little bit fussy in the start, especially with the first castings, but it isn't painful. Even when the tenotomy is done, it's so quick and the babies bounce right back. The third question is, what if it comes back? So relapse is a real concern, and it does happen. However, the vast majority of relapses are directly tied to not using the braces exactly as prescribed. When parents stick to the bracing schedule, the risk of the club for returning or needing a major surgery drops dramatically. And even if a small relapse does happen, can usually be fixed with another short series of casting or a very small surgery, avoiding the invasive surgeries. And finally, the most important question is, what will my child's life be like? So with successful Ponseti treatment, the answer is excellent. Your child will have a foot that is strong, functional, and pain-free. They'll be able to run, jump, dance, play sports just like any other child. They'll wear normal shoes. To the outside world, no one will ever know that they were born with clubfoot. Their future is one of limitless normal activity. So the worldwide adoption of the Ponseti method is one of the greatest orthopedic success stories of our time, but getting the word out there is still very crucial. If you're a new or expecting parent dealing with a clubfoot diagnosis, please know that there is incredible, effective, and gentle treatment out there. So look for a pediatric orthopedic surgeon who is trained in the Ponseti method. You can find resources and lists of providers through organizations like the Ponseti International Association. Ask questions, connect with other parents, and be your child's biggest advocate. Clubfoot has gone from a condition that once meant a high chance of life with pain and disability to one of the most correctable birth defects there is. So the legacy of Dr. Ignacio Ponseti isn't just about casting technique, it's the promise of a normal childhood. It's the joy of watching a child take their first steps without the limp. It seems almost impossible. It's seeing them tear across a soccer field, playing and scramble and doing all these things children need to do. So every child successfully treated with this method is a walking miracle and a testament to the simple revolution idea that sometimes the most powerful solutions are also very gentle. So if you found this video helpful, please give it a thumbs up and share it with another parent who might need it. And as always, thank you for watching. And until next time, keep it on little green bones.